I do this because I see the need for it. I think it's really related to how long I've worked on the ambulance and how many times we've gone to call after call of these individuals that have fallen. And there's a reason for that fall, so how can we rectify that? My name's Daphne Russell. I work for United Ambulance. I am the Community Paramedic Coordinator. A community paramedic is a paramedic that has been on the ambulance for a while, takes some additional training, and instead of having them in a reactive mode, they're more proactive. So how can they prevent the emergency, prevent the injury before it happens?
Community paramedicine is a new concept throughout the nation where basically in the past 5 to 6 years there's been development of paramedics doing home visits. The focus is to hit those clients or patients who don't have resources available to them and that fall into the gaps of the healthcare system.
Every paramedic, every EMT knows you're the eyes, the ears, the hands of the ER physician. So when Daphne went around and educated the family docs, the program took off because they were getting such instant feedback. This week I ended up meeting someone in the woods. Because they're homeless, they were actually having wounds from rolling into the fire. This person had no transportation, did not want to go do follow-up visits after the initial, so the PCP got in touch with us. Can you imagine, as a paramedic, you pull up to the call and you're working under the family doc. You know exactly their history, what they're trying to accomplish, and you're able to go in there and start first things first. It's a tremendous advantage.
So I show up in an emergency type vehicle. When I go up, I usually carry a red bag, and in that red bag I have everything that I would need to do a full assessment on them. From there, we go over the release and liability as far as United is concerned. We read through that, so they sign that. We go over what this program is, what services are offered through the program, as well as why they were referred to the program, and really kind of go from there. And then what we do is generate a game plan and how they feel that this program would be able to help them, how often the visits are really based on their needs, and what they're willing to accept as far as services from us. Language is not so much a barrier for us. We do have devices in which we can use that will actually translate for us. We take vital signs, so checking their blood pressure, their heart rate, listening to their lung sounds, how are they feeling that day, and what is normal for them. We do always look at what their past medical history is, their diagnoses, their medications. If anything were to come up that was abnormal, we would consult the primary care physician.
It really is an ounce of prevention versus a pound of cure. In this program, in targeting that, has been very successful in getting the environment cleaned up and getting other services back in so that the cost of the system goes way down, but more importantly, the health of the client goes up.
I see a lot of individuals that aren't eligible for home health but need some assistance in order to make them safer in the home, whether it's medication management or doing a home safety check. There's just a lot of people in need, so we hope that community paramedicine can kind of fill that gap of those individuals that need some assistance in the home.